Welcome. Thank you for joining us in celebrating Black History Month 2021. America is the land of opportunities, equality, independence, and where dreams are attainable. As African Americans hold these ideals close to their heart, they give birth to accomplishments achieved from hard work and determination. So let's begin to take a look at some prominent African American innovators, past and present, in the field of medicine. Dr. Thomas Elkins, born in 1818 and died in 1900. He was a surgeon, dentist, pharmacist, inventor, and abolitionist. Elkins was an avid inventor and designed many improvements for everyday items. In 1870, he patented an ironing table and quilting frame combined. In 1872, a chamber commode patent was received. In 1879, Elkins patented a refrigerating apparatus for chilling food or corpse using the evaporation of water.
Thomas Elkins was born in 1818. He was an African-American dentist, abolitionist, surgeon, pharmacist, and inventor. He lived in Albany, New York for most of his life, but traveled during his service as a medical examiner of the 54th and the 55th Massachusetts Infantries. In the late 1800s, African Americans was a growing population in pharmacy work. It was also considered easier for pharmacists of color to conduct trade with other people of color. African American druggists were particularly doing well in the South, where there was a greater African American population.
Elkins was part of one of the first waves of blacks in pharmacy. He received his education in pharmacy from Dr. Wincoop, a physician and druggist of the old school, and spent about 10 years working with him. Elkins ran a small drugstore which was located on North Swan Street for the first 4 years and later moved to Broadway and Livingston Street, where it lasted 13 more years.
Thomas Elkins trained T.H. Sands Pendleton and helped him land a position in the pharmacy of H.B. Clement, where Pendleton went on to have a distinguished career. Elkins studied dentistry under a man named Dr. Charles Payne, who hailed from Albany and Montreal, and also studied surgery with Dr. Marsh, also of Albany. Mr. Elkins was a very distinguished gentleman of many, many talents. One of his greatest accomplishments was an improvement on the chamber commode, the predecessor to the toilet. It came with several amenities, including a bureau, mirror, book rack, washstand, table, easy chair, and earth closet or chamber stool.
You would think for an invention that so many people use daily, sometimes multiple times daily, that this man would be more well known for his invention.
For all intent and purposes, he invented the modern day toilet. He made going to the bathroom a much more pleasant experience. Prior to him, there were no book racks, washstands, and all the other amenities that he added to the chamber commode. Another great invention that he introduced is the refrigerating apparatus, intended to prevent decay of food or human corpses. These two great inventions are used daily around the world today. No matter which one you use, we have Mr. Elkins to thank. Ladies and gentlemen, Mr. Thomas Elkins has made your life and mine so much easier. He's made the experience of going to the bathroom so much more enjoyable, and we don't even know his name. His name is Thomas Elkins, a black man. Mr. Elkins, we thank you.
Dr. Daniel Hale Williams, born in 1858, died in 1931. He is a pioneer in open heart surgery. He graduated from Chicago Medical College, known now as Northwestern Medical School. In 1891, Dr. Williams founded and opened the country's first interracial hospital and nursing school, Providence Hospital and Training School for Nurses, in Chicago. In 1893, Dr. Williams performed the first open heart surgery at the Providence Hospital without x-rays, antibiotics, surgical prep work, or tools of modern surgery. In 1894, Dr. Williams became Chief Surgeon of Freeman's Hospital in Washington, D.C., the most prestigious medical post available to African Americans then. There he made improvements that reduced the hospital's mortality rate. In 1913, Dr. Williams became the first African American to be inducted into the American College of Surgeons.
In July of 1893, a young African American man named James Cornish got into a bar fight and was stabbed in his heart. An injury like this meant sure death, if not from the wound itself, then from the resulting infection. Cornish was rushed to Providence Hospital in Chicago, close to death. Providence Hospital and Training School Association was established by an African American surgeon named Daniel Hale Williams. His insistence on antiseptic and sanitary procedures made him highly regarded and contributed to his high success rate in treating patients. When Williams saw his patient's chest wound, he knew he needed to operate or Cornish would bleed to death. After opening his chest, Williams saw the puncture wound in the sac around the heart, sutured it up, applied antiseptic procedures, and closed his chest. Thanks to Daniel Hale Williams, James Cornish walked out of Providence Hospital and lived another 50 years. It was the first ever successful open heart surgery.
Dr. Charles R. Drew, born in 1904, died in 1950. He was a surgeon and researcher. Dr. Charles R. Drew graduated second in a class of 137 in 1933 from McGill University Faculty of Medicine in Montreal. In June 1940, Drew became the first African American to earn a doctorate in medicine science from Columbia University. The term bloodmobiles was phrased from his innovative design for mobile blood donation stations. Drew's innovative work in blood banking was recognized by numerous awards and honors.
Did you know that Dr. Charles Richard Drew broke barriers in a racially divided America to become one of the most important scientists of the 20th century? His pioneering research and systematic developments in the use and preservation of blood plasma during World War II not only saved thousands of lives, but innovated the nation's blood banking process and standardized the procedures for long-term blood preservation and storage techniques adapted by the American Red Cross. Drew's interest in transfusion medicine began during his internship and surgical residency at Montreal Hospital from 1933 to 1935, while working with bacteriology professor John Beatty on ways to treat shock with fluid replacement.
Dr. Jane C. Wright was born in 1919 and died in 2013. She was a surgeon and researcher for chemotherapy. Dr. Wright earned her bachelor's degree from Smith College, graduated with honors from New York Medical College. She made numerous improvements to chemotherapy treatment. Dr. Wright developed a non-surgical procedure using a catheter to deliver chemotherapy drugs to previously inaccessible tumors in the kidneys and spleen.
The Conquer Cancer Foundation of the American Society of Clinical Oncology is honored to pay tribute to one of ASCO's founders, Dr. Jane Cook Wright, by naming a Young Investigator Award in her honor for her years of dedication to the field of oncology and passion for fighting cancer.
There were 7 original founders of ASCO in 1964, people who came together and said we should start exchanging some ideas about this treatment of cancer. And of the 7 original founders, one was Dr. Jane Wright, an African-American woman. So you cannot imagine how unusual being a woman physician in 1964, being a minority physician in 1964, and then being both a woman and a minority in 1964, and to be at the very top of this young and emerging field.
As an African-American woman just beginning her career as a physician in the 1940s, Dr. Wright was not only a pioneer in the field of cancer research and treatment, but also a trailblazer, opening minds and opening doors for those who would follow after her.
She never looked at things as obstacles. She looked at them as challenges. And I think that she was a very ambitious person, and I think she never let anything stand in the way of her doing what she wanted to do.
Dr. Wright's father and grandfather were both physicians. Her father, one of the first African-American graduates of Harvard Medical School, and the first African-American surgeon at a municipal hospital in New York. Dr. Wright worked alongside her father at Harlem Hospital, where they worked together on anti-cancer chemicals, later to be known as chemotherapy.
She comes from a long line of people who had a strong interest in medicine and in the area of cancer research as well. Her father was very active in doing clinical trials on some of the earliest anti-cancer drugs that were used, and she developed a strong interest in this. And in '67, she was appointed the Associate Dean of New York Medical College, where she graduated from, and she was the first African-American female to reach this rank in the country.
Dr. Robert Madden worked with Dr. Wright at New York Medical College and recalls her tenacity and her contributions.
She recognized the value of placing patients on clinical trials, and it was not exactly accepted by the medical public. Many of the doctors would not put their patients on clinical trials because they figured, well, this is an end of life exercise. And she didn't look at it that way. She looked at it as an opportunity to open the gates to new possibilities in treatment of cancer. And that way, she's a trailblazer.
During her career, Dr. Wright analyzed a wide range of anti-cancer agents, explored the relationship between patient and tissue culture response, and developed new techniques for administering cancer chemotherapy.
She never approached a patient with saying, I can only help you a little bit. She said, together, we're going to battle this. She is not only emblematic of the kind of a caring physician who you'd want to have or who I'd want to have as my doctor, but also as the role model and mentor of young physicians who would receive their training from her.
Although she retired in 1987, she still shows the same unwavering dedication to the field and to ASCO, and marvels at the organization it has become.
I think that every recipient of the Jane Wright Young Investigator Award needs to have an opportunity to really review her life and therefore appreciate her legacy. They are following in her phenomenal footsteps, you know, with tenderness towards patient care, with rigor towards scientific investigation, with focus that is always external and always on the patient.
Dr. Patricia Batt, born in 1942, died in 2019. She was an ophthalmologist, inventor, humanitarian, and professor. Dr. Batt became the first African-American female doctor to receive a patent for a medical invention. Dr. Batt worked in New York City as an assistant surgeon at Shadam Hospital, Flower and Fifth Avenue Hospital, and Metropolitan Surgical Hospital. In 1974, she completed a fellowship in corneal keratosprosthetic surgery. Then Batt moved to Los Angeles, California, where she became the first African American woman surgeon at the University of California, UCLA, Medical Center. She was also appointed assistant professor at Charles Drew University. In 1975, Bath became the first woman faculty member of the UCLA Jules Stein Eye Institute.
Dr. Patricia E. Bath was born November 4, 1942, in Harlem, New York, and knew from an early age she wanted to help others. She received her medical degree from Howard University College of Medicine in 1968 and went on to become the first African American resident in ophthalmology in 1973 at the New York University. While training in New York, Dr. Bath observed a lack of access to eye care for minorities and the poor and pioneered the worldwide discipline of community ophthalmology, which brings eye care to underserved populations. In 1976, Dr. Bath co-founded the American Institute for the Prevention of Blindness, and in 1986 she invented the laser phacoprobe, a groundbreaking treatment for cataracts. She patented the device in 1988, becoming the first African American female doctor to receive a medical patent. Dr. Patricia E. Bath of DCN Black History Hero.
Dr. Alexa Kennedy, born in 1951. She is a pediatric neurosurgeon and educator. In 1981, Dr. Kennedy became the first African American and female neurosurgeon. Dr. Kennedy made improvements in the field of pediatric and neurological surgery, research on the management of hydrocephalus and dysraphism in pediatric neurosurgery. Hydrocephalus is a condition in which cerebrospinal fluid accumulates within the brain. Spinal dysraphism is a term that describes numerous conditions present at birth that affect the spine, spinal cord, or nerve roots.
Alexa Kennedy was born on November 7, 1950. She was raised in Lansing, Michigan with her three brothers, Clinton III, Alan, and Mark. She was the only daughter of two graduates of historic black colleges. Kennedy's father, Clinton Kennedy Jr., was a dentist. Her mother, Elizabeth Kennedy, was active in civic affairs. Since her parents valued education so much, Kennedy was pushed to have a good education. Kennedy's role model was her grandmother because she always treated Kennedy like she was a person who was worth listening to, even when she was little. Later in life, she married George Davis. She is still alive today at age 67.
Kennedy was the only black girl in her elementary school, making her face racism at an early age. Kennedy didn't have much trouble in her work, but she did have trouble in her elementary school. Her teacher lied about what scores were hers on a test, and later the teacher was fired. In the 1960s, Kennedy was in high school, and she was recognized as a National Achievement Scholar.
When Kennedy started at the University of Michigan, her major was mathematics. Then she attended a health career program, and she redirected her studies to medicine. Kennedy received a BS in 1971 and an MD in 1975. While she was a student, she was elected to be in Alpha Omega Alpha, which is an honorary medical society. Later, she received the American Medical Women's Association citation. After college, Kennedy interned at New Haven Hospital for a year. After the internship, Alexa gained her residency in neurosurgery at the University of Minnesota from 1976 to 1981. When Kennedy got her residency, she said, "I didn't get it because I was smarter than everyone else, but it was because they needed black women and I was there and qualified." Afterward, the Children's Hospital in Philadelphia awarded Kennedy a fellowship in pediatric neurosurgery for a year. In 1982, Kennedy moved back to Michigan and took a job in neurosurgery at Henry Ford Hospital in Detroit. The next year, Kennedy transferred to pediatric neurosurgery at the Children's Hospital of Michigan. Then she became the assistant director of neurosurgery at the hospital, and 3 years later, Kennedy became the director of neurosurgery. Kennedy was the chief of neurosurgery at the age of 36, and after 18 years of working, she retired. When she wasn't treating patients, Kennedy was an instructor in neurosurgery at the University of Pennsylvania College of Medicine. In
1987, she began teaching as a clinical associate professorship at Wayne State University School of Medicine. While she was working, she received several awards. In 1984, Kennedy was named Teacher of the Year, and she was also certified by the American Board of Neurological Surgery. In 1986, Kennedy was honored as Woman of the Year by the Detroit chapter of National Association of Negro Business and Professional Women's Club. She also received the Candace Award from the National Coalition of 100 Black Women in that same year. I feel that Candy received a lot of recognition. She was honored and won many awards. I feel that Kennedy received lots of recognition. She was honored and won many awards. Kennedy is 67 and is currently retired. She lives in Pensacola, Florida. Alexa Kennedy shows the core value brave. Being brave means facing your fears and showing courage. Alexa shows bravery by going to school and facing racism at such a young age. She was brave when she decided to become the first African American woman to become a neurosurgeon in the United States.
I hope you enjoyed this presentation celebrating African American innovations to medicine and the medical field. Our next presentation of African American innovators will highlight contributions in the field of engineering and technology. Thank you.